Today we're going to talk about Chapter 4, the surgery section, the integumentary system. And I wanted to begin by reminding you of the color key that you find in the CPT code book. If you can get used to thinking about it when you identify a color, thinking about what you're looking at. The sections of the code book are black, like surgery, anesthesia, radiology, pathology. And then within each section, there are subsections, and those subsections are green font. So in the surgery section, you've got the body systems that are the subsections, and in this case, we're talking about the integumentary system. And then in red font, it talks about parts of the body within that system and major classes of procedures. For example, in the integumentary system, the parts of the body, it talks about the skin, the subcutaneous and accessory structures, the nails, and pilotidinal cyst. And then the major classes of procedures are the introduction, the repair, which is closure, destruction, and then the breast, different procedures on the breast. Then the blue font represents a type of procedure. For example, introduction and removal, incision and drainage, those types of things. And then it's further subdivided by black again, looking at definitions and surgical preparations. So if you learn that about the code book, it really does help you navigate it quicker when you start looking for a code. If you go to the table of contents within the integumentary system, you see those colors that we just referred to in the previous slide, where the red is the parts of the integumentary system, the blue are types of procedures. Okay? Just another way to get very familiar with your code book. There's a lot of facts to remember about the integumentary system. I'm going to review the major ones here. Be mindful that even though I am lecturing on this chapter, I will not be able to cover everything on this PowerPoint, so you will have to do reading and study of your chapters in your textbook in addition to watching the podcast and studying these slides. Anatomic modifiers like left and right are not appropriate for skin repair. You're only going to use that when you're looking at paired organs or paired body parts that have a definitive right and left side. Anatomic modifiers are used for procedures performed on the breast, like left, right, or a -50 for bilateral. For a single wound, you're going to report the depth using the deepest level of tissue removed. And for multiple wounds, you're going to sum the surface areas that are at the same depth, not combining sums from different depths. In your CPT textbook on table 4.1 on page 62, it talks about necessary documentation for removal of skin lesions. I recommend that you make yourself familiar with that so you know what you're looking for when you begin to read a report. You must read the guidelines. I refer to them in my lectures, but you really have to take the time to read the narrative before and after codes so that you are making sure to apply whatever guidelines need to be applied in a given situation. It's different from the ICD code book when we had the guidelines all in front of the chapter. In CPT, they are throughout, they're some in front of the chapter, but they're also throughout the chapter, the section that you're talking about, and they often refer only to those codes around them. And as I said in a previous podcast, it's a lot of reading in CPT, and you can't get around that. You just have to take the time to read those guidelines, as well as any parenthetical notes that follow your codes. Be sure you do that too. More definitions in the code book. Shaving of epidermal and dermal lesions. The patient requires a suture closure. You've done more than shave. You're looking at an excision now. So just keep that in mind, because the doctor may not use the same words that you are seeing in the code book. You're going to have to interpret what he's written. And this is an example. If he calls it shaving and then he tells you he put so many stitches in it, you can't code shaving. You're going to have to code excision. Malignant lesions of skin include basal cell carcinoma, squamous cell carcinoma, and melanoma. And benign lesions of the skin include neoplasm, cicatricial, which is scarring, fibrous, inflammatory, congenital, and cystic lesions. And for the word biopsy, it's not unusual for tissue that's been excised, destroyed, or shaved to be submitted for pathological examination. That is considered part of the procedure and is not, by definition, a biopsy. Wound repair falls into simple, intermediate, and complex. A simple repair is without involvement of any of the deeper structures below the subcutaneous layer. It's usually one layer, and if the doc says he's just doing steri-strips or bandages, that is not a repair code. You're going to be assigning an evaluation and management code, and that's one of the different chapter in CPT. Glue, Dermabond, which is often used in surgery repairs or laceration repairs, is coded using a repair code. Intermediate is often referred to as layered closure, meaning there's more than one layer, but you can also have a wound where there's only one layer when he actually got around to suturing it, but there was so much material, foreign material in there that had to be cleaned up and removed before you could do that single layer. When you have that kind of extensive cleaning, you are going to code it as an intermediate repair. Complex repair goes beyond a layer closure, and it's when you're talking about a scar revision, debriding, extensive undermining, using stents or retention sutures. When you've got wounds that are described as torn or angular, jagged, irregular, or stellate, they may require a complex repair. And layered closure, again, is part of this wound repair, meaning more than one layer. When multiple wounds are repaired, coders can add together the links of those in the same classification and from all anatomic sites that are grouped together into the same code description. When more than one classification is repaired, the more complicated repair is listed first, followed by the less complicated repair. Modifier 51 is used for physician billing, should be reported to identify the performance of more than one procedure. When you're coding repair that's some superficial, some intermediate, you're going to get the modifier -51 on the simple because your intermediate is going to be your primary procedure. Debridement is reported separately only when gross contamination requires prolonged cleansing, or when the debridement is carried out separately without primary closure. For example, gunshot wounds or stab wounds, things that are the abdominal area, it's not uncommon for the doctor to clean that all out and leave it open to heal. So you're not going to be coding a closure in that case, you're only going to be coding debridement. There are 4 primary classes of main terms that you should be familiar with by now. You are looking up the procedure or the service, the organ or the anatomic site, the condition, and the use of a synonym, eponym, or abbreviation. So let's get started on exercise 4.1, number 2. The mesh. The patient had a mesh inserted during an inguinal hernia repair a couple of years ago. The patient presents for removal of the infected mesh and debridement of the necrotic tissue. The physician performed a debridement of the wound, including the fascia, and removed the mesh. Now in purple font and bolded, I have highlighted each word or phrase that will have an impact on the main terms and the way that you're going to code this. You have 2 procedures mentioned. One is the removal of the mesh and debridement of the necrotic tissue. So here is, in the index, you would have your removal, and the debridement is shown here. Now in this example, I've shown the range of codes that are given in the index. I will not always do this. I expect you to go to the index when you're following along in these PowerPoints. You go to the index, you find out what the range is, you look up all those codes, and you decide which one best describes this procedure. And that's what you're going to assign. Likewise, I have reproduced the code description on these slides. I will not be doing that very often, but for the case in point, I wanted to make sure that you see that although in the index I looked up removal first and then debridement, when I actually read the codes, I see that I will be coding them differently. Like for example, when you read the description for the removal of the mesh, it says list separately in addition to code for primary procedure. It doesn't include the debridement. So your debridement is your primary procedure, so that's going to go first. And then the removal of the mesh is going to go next. And here it is in the code book. What I'm showing you here, I've highlighted in yellow the guidelines under debridement. I do expect you to read those guidelines. And then you can see where I've chosen my codes to describe this procedure. There's the debridement. And then the removal of the mesh is also under the procedure of debridement, different code. Exercise 4.1, number 4, the patient is seen for treatment of a diabetic foot ulcer. The measurements are given. The surgeon performed a debridement of the skin, subcutaneous tissue, and extensor digitorum brevis muscle. And I have a note reminding us for a single wound, report the depth using the deepest level of tissue removed, and it's being debrided down to the muscle. And here's the index with all the codes that are given. And you would look up those codes, read those code descriptions, and choose which one described this diagnostic statement. And the answer is 11043. Here's the codes. And we read in a previous slide the guidelines under debridement. If we had not done so, I would expect you to read those guidelines again since you're in that section of the code book to make sure you're not missing anything. It really is impossible to memorize guidelines because they have so many qualifiers. When you use this code, don't use it with this code. So it's just so many numbers and words that I think you really can't memorize it. You have to just be in the habit of going back and reading those guidelines each time before you assign a code. In this example, the physician excised a 1 centimeter squamous cell carcinoma from the forehead, and it tells you the margins of 1.0 centimeters around the lesion. Several things to know here. Squamous cell carcinoma is a malignant carcinoma. So you're going to be looking up excision of malignant lesions. There's a table in your CPT textbook that illustrates the documentation that's needed for removal of skin lesions. And there's also in your code book, CPT Code Book 2017, page 75, how to measure and code the removal of a lesion so that you know the math that goes into this. So it's a lesion, skin, excision, malignant. There's your range of codes. You go in, you read the guidelines under malignant lesions, and you pick your code. And here we are in the code book. I've shown you which body system I'm in, what body parts, what procedure, excision, malignant lesions, and then the code I assigned, 11643, because the diameter matches the math. In this exercise, the physician removes 17 skin tags. And here you have the codes that are involved in that. And you see that 11200 is including 15 lesions, and the add-on code 11201, each additional 10 or part thereof. So the first 15 of those 17 skin tags would go under the first code. Then you would need the second code, 11201, to account for the last two. And here we are in the code book. Removal of skin tags has its own section. So there's just a very short little piece up there about that's your guidelines, and then you have your your two codes that describe removal of skin tags. Exercise 4.2, number 6, the laser removal of 14 benign skin lesions from the back. We're calling it removal, but it's really destruction if you're using a laser. You're destroying those benign lesions, but they are benign, so you're looking for excision or destruction of benign lesions. So destruction would be your procedure. And the code that's chosen describes up to 14 lesions, which is how many we have here in the diagnostic statement. So only one code is needed. And here it is in the code book. And I have a note to myself beside 17110. A wart is an example of a benign lesion that might be destroyed. Exercise 4.2, number 8, the pairing of 3 hyperkeratotic lesions from the patient's foot. Lesion would be our main term. Pairing is the procedure. And the way the codes read, 11056 describes the pairing or cutting of benign hyperkeratotic lesion 2 to 4. And in our case, there were 3. And here you are in the code book. The part of subcutaneous, the part of the integumentary system we're talking about is the skin, subcutaneous, and accessory structures. The procedure is pairing or cutting. And I make a note, this is common for calluses or corns on the feet. This would be a description of what they're doing there. In your textbook, page 66, operative report number 2, the correct answer is 11308. And here it is in the code book. Next exercise, a child is seen for a superficial laceration of the right knee. The physician repairs it with a simple suturing, 2.3 centimeters. We look this up, and it is a simple repair. It is less than 2.5 centimeters, so the code 12001 is accurate. And here you go with the codes. And here's an ED report from the textbook, pages 71 and 72. And you see there's 3 centimeter superficial and a 5 centimeter subcutaneous layer. The wound, you have intermediate and simple. Your intermediate is your more serious wound, so it's going to be your first procedure. Then your simple repair would go next. And here they are. There's the intermediate repair. And here's your simple repair. Again, you would be read your guidelines around these codes so you don't miss anything. The next exercise, the physician performs a wide resection of a 3 square centimeter malignant skin lesion of the left leg. The defect required an adjacent tissue transfer measuring 15 square centimeters. So your main term is a skin graft and flap. Anytime you're looking at a defect and doing a tissue transfer. The code book on page 82 talks about the primary and the secondary defect, and you see how they're measured together to determine the code. And the correct answer is 14021. Defect 10.1 square centimeters to 30 square centimeters. And here you see that group of codes. The operative report number 2, your main term is your skin graft, a free skin graft, split thickness, and your correct answer is 15100. And here we have in this section under autografts or tissue cultured autografts, the split thickness autograft. Operative report number 2, the main term is excision of the cyst of the breast. And there's 2 paths you can use to get there. And the answer is 19125, the left breast. And here you have the code 19125. That's all I have for chapter 4, the integumentary system. If you have any questions, please post them in discussion board, along with the path that you attempted to try and find the answer. You may also email me or call me, but you must include that path in our conversation. Thank you so much and have a nice evening.